We have none other than Dr. Randeep Guleria, the country's most renowned pulmonologist and AIIMS director, who maintains that even as COVID cases are rapidly rising in the country, we are still to reach the peak. Now, Dr. Guleria, heading the core team of coronavirus experts, sheds light on India's manufacturing capabilities and how it may be on an advantage in this battle against coronavirus. Let's first take a look at this report. Dr. Randeep Guleria is a luminary in the field of medicine, playing an important role in handling the biggest health crisis the world has faced in decades. He is the director of India's premier medical facility, All India Institute of Medical Sciences in the national capital. Heading a team of coronavirus experts, Dr. Guleria's careful research of the pandemic, vaccination and its spread gives an insight on COVID-19 study in the country. Incidentally, India's first vaccine trial was also carried out at AIIMS. Dr. Guleria says that while he feels that the pandemic is yet to peak in the country, India has the capacity to manufacture a large number of vaccines given the commitment of the centre and the nation's manufacturing capabilities. Bureau Report, Republic TV.
Dr. Guleria, thanks a lot for speaking to Republic TV. A very happy Independence Day to you. And from everyone here and from across the country, we want to thank you for the selfless service that doctors like you are doing at this time.
Thank you very much. And first of all, I would like to wish you and all the viewers a very, very happy and healthy Independence Day. There is a lot that we are doing. We're proud to be Indians
Dr.
today.
Guleria, how
and
do you...
I think we are... Yes, please go ahead.
Please go ahead.
So like I was saying, we are proud to be Indians today, and I think we have done a remarkable job as far as COVID-19 is concerned. The country has started off with just 1 or 2 labs, and now we have more than 1,400 labs. We had shortage of PPEs, and now we are able to export PPEs. We are doing more than 7 lakh tests per day, and this is a remarkable achievement that India has achieved. And I think, as you rightly said, we have turned this challenge into an opportunity as far as Make in India is concerned, as far as Atmanirbhar India is concerned.
Yes. Dr. Guleria, I think the one thing that everybody wants to know from you, as the Prime Minister also mentioned today, is what's really happening as far as the Indian vaccine is concerned, isn't it? AIIMS is also participating in the trials. Could you give us the latest on that? And what is the revised timeline, if any?
So 2 or 3 things. One is that we have 3 vaccine candidates which have come into clinical trials. The Serum Institute vaccine, which is also with Oxford, has now reached phase 3, and AIIMS and other institutes are involved in now large trials to see how effective this vaccine is and how safe it is. As far as the bio vaccine, which is through with ICMR, and is already completed phase 1 studies. We have now completed 28 days trial in all our subjects and have found it to be safe. We are now coming into the phase 2 trial to see that it is an effective vaccine. It's a vaccine which is being supported both by ICMR and Bharat Biotech. And I'm sure that very quickly, by the end of this year or early next year, we should be able to have a vaccine available. We're also working, the government is also working with a strategy so that everyone can get the vaccine no matter which part of the country he is in, and prioritizing the vaccine so that those who are at higher risk of morbidity and mortality get the vaccine as soon as it is available.
Dr. Guleria, I also wanted to understand from you, we are in unlock mode, except for a few parts, the country is mostly opening up. And the fact that the recovery rate has gone so high is also a huge sense of positivity in that. But we can't afford to be complacent. So at a time when people have mostly started to move out, what is your message to the people of the country and how we still need to be careful and what we still need to do?
So I think we need to understand that the pandemic is evolving and has moved from one part of the country to the other part. If you look at Delhi, we have already peaked, and our number of cases, which were more than 4,000, around 4,000 per day, have come down to around 1,000 per day, and we need to sustain that. There are other cities also which have now peaked, But there are other parts of the country where the cases continue to rise, and they will peak over the next few weeks. And then we will be able to say that the whole country has peaked and the cases have started coming down. But cases coming down does not mean that the pandemic is over or the virus is not there. The virus is still lurking in the background, looking for an opportunity to really again have a second wave or again have an increase in number of the cases. And it depends on us how we behave if we want to keep the number of cases down. And therefore, there can be no complacency. We have to be very careful in terms of infection control, in terms of wearing a mask, in terms of social distancing, in terms of not creating a crowd. And that becomes very, very important for the next few months if we want to keep the cases down.
Dr. Guleria, even in your distinguished career, the last 5-6 months must have been a great challenge. Today we are celebrating COVID heroes like yourself, and as the head of AIIMS, of course, there must have been great pressure on you. I want you to share some insight into from your experiences in the last 5-6 months dealing with COVID pandemic, and also your message to the entire medical fraternity that has truly risen to the occasion.
So this last few months have been, I think, something that has changed the life of many of us, and we have now really learned to live with the new normal. For me, it has been a change both at administrative level and at a personal level. At an administrative level, it was a big challenge of how do we really convert our hospital into a COVID facility, and how do we really do both COVID care and non-COVID care? How do we get our healthcare workers motivated? How do we protect our healthcare workers? And how do we increase the capacity of our hospital in terms of ICU beds, in terms of the hospital beds for COVID care? We were able to do that. We were able to increase our capacity to around 1,700 beds. And at one point in time, we had almost 900 COVID positive patients that we were managing. We had a full ICU. And I'm very happy that the whole team came together in terms of managing these patients. At a personal level, we had to really work aggressively at home. Both myself, my wife, and my son were working in different hospitals and managing COVID patients. And we had times when we had to eat separately in different rooms, sleep separately because of the fact that we would come in contact with COVID positive patients and had to isolate ourselves. So it was a challenging time, a stressful time. And I think the message that I would like to give is that every cloud has a silver lining. And I'm sure that we will come out stronger, both physically and mentally, out of this pandemic. And as a nation, we will show the world the way in terms of how we can really come out of a pandemic in terms of production, in terms of vaccine, in terms of how healthcare workers can manage, even when you are challenged as far as resources are concerned.
Dr. Guleria, really appreciate you speaking to us. We could, of course, continue to speak to you. There are so many insights we'd love to know. So we look forward to having you again with us. Especially, we'd like to prick your brains on the vaccine that everybody has on their minds. But that for another time. Have a great day today, Doctor.
Thank you very much. And it's a pleasure, as always, to be on Republic TV. Thank you very much.
Thank you.